Good morning, ma'am. I am Perlini Pabroques and I am going to perform the procedure in administering an intramuscular injection. So, intramuscular injection deposits medications into the muscle fascia, which has a rich blood supply, allowing medications to be absorbed faster through muscle fibers that they are through the subcutaneous route. The IM site is used for medications that requires a quick absorption rate but also a reasonably prolonged action. Due to the rich blood supply, IM injection sites can be absorbed larger volumes of solution, which means a range of medications such as sedatives, antiemetics, hormonal therapies, analgesics, and immunizations can be administered intramuscularly in the community and acute care setting. So for the assessment, we need to assess for the allergies to medication, specific drug action, side effects, and adverse reaction, client's knowledge and learning needs about the medication, assess for tissue integrity of specific site, assess for client's weight and age to determine site and needle size, and assess the ability of the client to cooperate during injections. Second is to determine whether the size of the muscle is appropriate to the amount of medication to be injected to make sure that the medications are being inserted in the muscle tissue. Next is to assemble equipment. This is to maximize time and avoid delay. So the equipment that we need are MAR or computer printout MAR or medication administration record, vial or ampule of the correct sterile medication, appropriate syringe and needle, antiseptic swab, dry sterile gauze, and clean gloves. Next is to check the MAR or the medication administration record. Check the labels and medication carefully against the MAR to make sure that the correct medication is being prepared. So this is to ensure that the correct medication is being administered to the correct patient. Next is to follow the 3 checks of drug administration. First is when it's taken from the medication cart. Second is before withdrawing the medication. And lastly is after withdrawing the medication. Next is to confirm that the dose is correct. This is to avoid medication error. Next is to organize equipment because organizing equipment will provide smooth procedure and easy access to the materials or equipments needed. So for the implementation, the first thing we need to do is to perform hand hygiene and observe other infection control procedures. This is to avoid or prevent passing of microorganisms from one another. Next is to prepare the medication from the ampule or vial for drug withdrawal. Next is to provide privacy to gain trust and cooperation from your patient. And then, prepare the client. Introduce yourself and verify client's identity. So, good morning, ma'am. My name is Perlin Pabroques and I am your student nurse. May I know your name, ma'am?
I'm Ariel Gomez.
Thank you, ma'am. And then, assist client to appropriate position depending on the chosen site. May I... And then, obtain assistance for uncooperative clients. Next is to explain the purpose of the IM drug administration using language that the client can understand. So, ma'am, explain ko lang po sa inyo ang purpose po ng IM drug administration. Ang IM po ay ginagamit kapag magtuturok po tayo ng vaccine, kagaya ng tetanus toxoid na ituturok natin sa inyo, para po mas mabilis ma-absorb ng bloodstream ang medication po or ang drugs. Next is to select, locate, and clean the site. Select a site that is free from lesions, tenderness, hardness, swelling, and localized inflammation, and site that is not used frequently. So, next is to locate the exact site for the injection. So, ma'am, may I open your... So after locating the exact site, put on clean gloves. Next is to clean site with antiseptic swab and allow the area to dry thoroughly. And then, place and hold a dry cotton ball or swab between the third and fourth fingers of the non-dominant hand or position the swab on the client's skin above the intended site. Next is to prepare the syringe for injection. Remove the needle cap while waiting for the antiseptic to dry. And then, inject the medication. Grasp the syringe with your dominant hand between the thumb and finger, with palm facing the side or upward for a 45-degree angle insertion, or with the palm facing downward for a 90-degree angle insertion. Prepare to inject. Using a dominant hand, pinch or spread the skin at the side and insert the needle using the dominant hand and a fierce, steady push. So, when the needle is inserted, move your non-dominant hand to the end of the plunger. And then, inject the medication by holding the syringe steady and depressing the plunger with slow and even pressure. The needle should be embedded within the skin for 5 seconds after complete depression of plunger to ensure complete delivery of the dose. And then, remove the needle. Remove needle slowly and smoothly, pulling along the line of insertion while depressing the skin with your non-dominant hand. If bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. Dispose supplies appropriately. Remove gloves and perform hand hygiene. And then, document all relevant information, the medication given, the dosage, time, route, and any assessment. That's all, thank you.